We've always believed that youth equals health, but the data is now telling us a very different story. Something has fundamentally changed. We are no longer seeing lifestyle diseases, non communicable diseases in our 40s and 50s. We are now seeing early signs of them, or even people with active disease, even in the 30s, and sometimes early signs even in the 20s. The Health of the Nation 2026 report, which is based on the health check data across Apollo hospitals, brings this shift into very sharp focus. And one of the most striking findings in this year's report is that health risks are beginning far earlier than what we traditionally anticipate. 2 in 3 college students have at least one health abnormality, and among over 1 lakh adults who were screened under 30, over half already have abnormal lipids, and nearly half have prehypertension, which is a silent precursor, and 1 in 5 showed dysglycemia, 1 in 10 already hypertensive before age 30. And even in the younger age group, a lot of them have been overweight, obese, and a lot of the around 38% of young women in the 17 to 22 age group were anemic. So these are not numbers that we are very happy with. So to help us understand what this really means, I'm joined by Dr. Rajesh Matta from Apollo Hospitals, Navi Mumbai. Dr. Matta is a senior interventional cardiologist with over 8 years of experience, specializing in the management of complex heart conditions and critical cardiac interventions. He focuses on delivering patient centric care to improve cardiovascular health and long term outcomes. So, I think he will be the best person to answer our questions about this particular finding in the Health of the Nation report today. Welcome, Doctor, and thank you so much for joining us today. Let me begin by asking you this. We often, as I said, think of conditions like diabetes or dyslipidemia or hypertension as something that develops in the later decades of life. But today, the findings are different. Young adults are showing early markers. So, what is really happening? Is there a new baseline for age related risk? Are we seeing a shift in when disease truly begins? So, doctor, I wanted to begin by asking you that, as I said, we often think of hypertension or diabetes or dyslipidemia as something that comes in the later decades of life and some disease which is of the elderly. But today we know that it's not true. And there are a lot of young adults who are showing early signs of these diseases or actually have these diseases. So, are we seeing some sort of a shift in when disease truly begins, or is it just that is there a new baseline, something has shifted, or is just that more and more of these are detected? So, what is your view about it?
Yes, so this shift that we are speaking about is actually real and it's very concerning. So traditionally, what we thought of blockages or cholesterol issues or diabetes, we thought of them as beginning in mid to late life. So that was what was the traditional teaching in our medical schools as well, and that is what we saw during our training times, that most of the patients came with these kind of illnesses in their 50s, 60s, 70s. What has happened in the last few years is, as you very rightly pointed out, is that we are seeing these diseases come up very earlier and earlier. So definitely there's a contribution of both the situation. One is that our lifestyle has become such that these diseases are developing earlier. Second is that they're even being detected earlier, so people are more aware now. So both the situations, both the scenarios are there, wherein our lifestyle, our diet, and the kind of stress that we have, and the sleep disturbances that we face, all of these are present, which are precipitating these illnesses earlier. And plus the awareness is also there, and so we are detecting these earlier as well. So I think it's a combination of both the two situations.
Also, we find in our report, and also we are quite aware the evidence exists that there is also obesity or at least overweight situations in young people. But there is also a lot of them with deficiencies. There might be anemia, there might be vitamin D, B12, and other deficiencies. So, what exactly is going wrong? How do you interpret this? Are we looking at, malnutrition, as in some sort of imbalance in they're eating the wrong thing and not eating the right things, or what exactly is going wrong, and what would your advice be to them?
So absolutely, I would say this is a very classical example of what we call a hidden malnutrition. So what happens is we are having more of caloric intake, so which is eventually leading to obesity. On the other hand, the kind of diet that we are having is deficient in various nutrients like vitamin D, B12, iron. So on one hand, the kind of diet that we have provides us with excess calories. On the other hand, that it does not contain enough amounts of nutrients. So this has happened mainly because we are having more and more of refined carbohydrates, more fat-rich food in our diet. So I feel, yeah. So this kind of a paradox is what is creating the health issue right now that we are facing. So my recommendation right now to everybody would be just to keep a watch on your caloric intake and make sure that we are having, a lot of non-processed foods, something which is very naturally available, readily available, seasonal foods. All of these kind of things tend to have a lot of nutrition value to them. And caloric intake, yes, we have to be cautious about that too.
Suppose more of home cooked food
More of home
planning
cooked.
needs.
Yes, yes.
Right. We found in our study that there were almost 60% and above of college students who had some abnormal finding or the other. So, is this something that tells us that these kind of so there should be screening, there should be some kind of a health check program that traditionally used to address people much older. So, do you think there should be a kind of a structured way in which these not only screening but also advice on prevention, advice on lifestyle is given to the youth?
So definitely, I feel that these kind of programs and these kind of situations should exist wherein, we are able to impart information as well as screen patients at an earlier age. So what is happening is, we're detecting them in the 30s, in the 40s. Most of the people come with diseases which are already manifest. However, the
Yeah.
process has begun quite early, in their teens. All of these, the health habits or the, kind of lifestyle that we're having, all of the patterns are set up in our teen years. So I feel, when we start screening them at that particular age and start imparting knowledge, some sort of a lifestyle modification early on, we can, prevent the development of all of these illnesses in the 30s and the 40s, and come back to the previous scenario that we had earlier. So screening definitely is going to play a role, and definitely education as well is going to play a role to, kind of delay all of the onset of all of these illnesses.
Right. And if the baseline is now coming to under 30 years for these kind of lifestyle diseases, so what do you think will happen to India's non-communicable disease burden over the next 10 to 15 years? Do you think that, we are looking at some sort of an epidemic of people who also will have an earlier onset of complications, which is again worrying because, the productive years, the years in which the nation will benefit from all their hard work, all their and then their families, their children. That is the peak of anybody's life. So do you foresee anything like that happening?
So
Do you,
I feel, what we're considering the baseline right now should not be considered a norm, When we're discussing of it like of the situation like a baseline, it should not be considered to be normal. We overhear a lot of conversation, people saying, yeah, BP here is sabko hi hota hai. So we have to understand that this baseline is, pathological and it's not considered to be norm. So definitely, with the kind of scenario that we're seeing, the flooding in of the people, the younger age group population that we're seeing with cholesterol, with sugar, with even cardiac, events. Like as a cardiologist, I have seen a lot of patients. I can say maybe in the last couple of months, I've had at least 5 to 7 patients who are less than 35 who've had a cardiac event. So with this kind of scenario, I know that that patient is going to live at least for 20 to 30 years. That is the kind of life expectancy that we're expecting. The patient has to live with that disease for that many years. The more the duration the person is living with the disease, the more the chances of complications developing in the future. So definitely we're looking at an epidemic in future. It's going to be like a pandemic, not an epidemic. I would say it's going to be a pandemic of maybe diabetes or cardiac issues or health related brain related strokes, all of this. So the time to change is right now, so that we don't go in that direction. But I can tell you, with the kind of practice that we're seeing, with the kind of patients that we're seeing in our practice, we are already heading in that direction.
that's extremely alarming, doctor. But Supposing you were to tell our youth, like, the top two or three interventions that they can take up as of immediately right now to make sure that, they don't fall into that category of these people who get all these NCDs and lifestyle diseases, what would you suggest?
So if I had to prioritize, I would focus on a couple of, or maybe two or three things that we need to do on an urgent basis, or on, that we need to take action on immediately. One of them is physical activity. If we compare our physical activity to the Western world, we'll notice that we are significantly sedentary as compared to our Western counterparts. This is something which is non-negotiable. What is recommended by the health bodies throughout the world is at least 150 minutes of moderate intensity exercise every week. So cardio with strength training has to be mixed in that scenario, and at least 150 minutes a week, that's about 30 minutes for 5 days a week. We give weekend off also to our our youth, that you can take a weekend off, but at least 5 days a week you do 30 minutes of moderate intensity exercise. That is definitely going to make a difference in the future. We think of health in a very different manner. When we think about money and finances, we start thinking early that we need to invest for our old age. We need to, kind of build funds for our old age, so if we think of health in a similar scenario, that whatever we are doing today is going to help us build our health in the future. So that is something that we need to start. That kind of mindset has to be inculcated right now. So one thing is physical activity. Second thing is the diet that we are having, the kind of food that you're eating. Please be mindful of what you're eating. Though the companies, the brands may label it at whatever, just be mindful of what you're having. What I would suggest is, our local homemade food is has very good nutrition. It contains most of the nutrients. We need to just be mindful of what we are having. Packed foods and all of those have a lot of ultra processed carbohydrates, a lot of ultra processed sugars, which are just calories. We can call them as empty calories without much of nutrition. So one is exercise, second is diet, third is adequate sleep. So we see a lot of our youth getting stuck in a night shift. The circadian rhythm, that 24-hour rhythm that the body naturally has, definitely gets broken when we're doing all of those kind of things. Again, the role of screen also comes in this scenario. We are all busy watching social media apps in the night time, sleeping late, getting up late. So the circadian rhythm, the moment that gets disturbed, that also affects our body on a longer duration.
Right. I also wanted to end by asking you about, apart from the diet, about the physical inactivity and the poor sleep, but there are other things affecting, people's mental health and behavior as well. One, you did mention about the screen overuse, but there's also inordinate amount of stress. Looking back, it looks like, or unless that we have forgotten, but maybe it didn't undergo that much of stress, or I don't know what that situation is, but there's also a prevalence of high prevalence of, substance abuse, or there is a normalizing of some of these behaviors, partying and, those kind of things, which is, when these are advised against, it is largely seen as something that is like, you're not cool kind of thing. So what would you advise? How do these affect these parameters, and where should people draw the line?
So we can call these as soft lifestyle variables, but they tend to have direct biological effects. When we speak about chronic stress, it affects our cortisol, it affects our insulin sensitivity of the body. When we speak about sleep deprivation, that also affects the sympathetic system of the body, that affects the hunger pattern of the body. Similarly, screen overuse, it promotes sedentary behavior, sleep disruption happens, and same is with the situation with early substance abuse as well. Smoking, alcohol, that tends to accelerate the damage to the heart, it accelerates the damage to the body per se. So, what happens is, traditionally, when we're speaking of these soft, why are we calling them as soft variables? Is because you cannot track them with any of the tests. These are something which we don't measure on the tests routinely, but we see them in the lifestyles. So definitely we need to draw a line, with respect to this, all of these situations. No amount of substance abuse is healthy. All of them tend to affect the heart. All of them tend to affect our health as well. Screen time definitely needs to be limited. It affects our circadian rhythm. So all of these parameters, I would say, everything can be done, but we have to, moderation. Everything has to be done in moderation.
Right. So thank you so much, Dr. Matta, for these very valuable insights. So what clearly emerges from this discussion is something that is both concerning and both actionable as well. So that is, in a way, encouraging. So what we have learned today, dear viewers, is that risk is not anymore a midlife phenomenon. It's becoming something that's manifesting much earlier. And in many cases, it is rather easily overlooked, silent, gradual, but then equally important is this, because early risk also means early opportunity to capture it, to understand it, to take steps, and to reverse it. And there is a lot of help available today to screen, to assess, to monitor, to be mentored, to be given medical advice. And we know what works and it can be reversed. The findings from the Apollo Health of the Nation 2026 report should challenge each one of you to think how to define and redefine health for yourself. And however young you are, I think your health is non-negotiable, and that's something that you start early. And the seeds of good health, when they're sown early, they will reap benefits forever and ever. And it will not hamper quality of your future life. It will help you to have a very productive, happy, and successful life. So the time is now. So you need to know more about this Health of the Nation report by you could easily see the whole report by downloading the entire report, which is there in our website, www.apollohospitals.com. And you can also see the links in the description, the link in the bio if you're on Instagram. And please do download and read this report so that you can explore and take a very proactive approach towards your health. Thank you. This is Srinidhi Chidambaram. Namaste.